Hello there, I'm Dr. Jay Kovar from the Harris County ESD11 EMS. This month our question comes from the Cypress Creek YMCA.
Hey Dr. K, this is Kennedy with the D. Bradley McWilliams YMCA. Can you tell your viewers a little bit about water safety and drowning prevention, please?
It's warming up outside, it's nice to get out, and the question is, hey, what can you tell me about water safety and what can I do to keep from drowning? The question comes into what is drowning, and it's changed quite a bit the more we know about it. Drowning actually is the aspiration of water into the lungs that impedes our ability to get oxygen into our system, into our brains. That results in neurologic injury and cardiac arrest. There are certain terms that we don't use anymore. We don't use near drowning. We don't use dry drowning. Every drowning involves the aspiration of water into your lungs and the obstruction of oxygen from reaching your system and into your brain. Every year there's about 8,000 unintentional drownings in the United States. Roughly half of those victims are going to die. A significant number of them are under the age of 14 years of age. 10 people a day suffer in a drowning event. 40% of those start happening from May through August. Most of those happen on the weekends. For every child that drowns, 14 wind up in the emergency department with some kind of related injury. So almost 80% of the drownings in the United States are male. A third of those are children, and a third of those are fatal. And a third of those have some severe neurologic impairments if they should survive. If we look at the age of those drowning victims, they start very young. A lot of those children under the age of 1, they tend to drown at home. They drown in bathtubs, they drown in open buckets, they drown in the toilet. As they get a little older and start walking, they start moving out into the environment. They drown in swimming pools, they drown in hot tubs, and they drown in big bodies of water like behind me. When you get older, 5 to 14 years of age, we get into activities, we get into summer water sports, we get into open water sites and boating. Half of the drownings that occur in children happen in the home pool. About a third are either in the home of friends, neighbor, or family. Most often, they were just seen inside the home. They've been missing for less than 5 minutes, and most parents are usually at home during that time window. So the obvious initial thing is to watch the children very, very closely, but if you do have to rescue your child or anybody else that's drowning, there's a couple of very important things to remember. And again, rescuer safety is really, really important. We don't need 2 victims. There are a lot of instances in where the rescuer becomes a victim as well. The rescuing requires you to have specific skills, requires you to be comfortable in water, and if you're not comfortable in water, never enter the water to try to rescue someone. If you pull someone from the water or they're out of the water, etc., the important thing is, are they breathing? If they are breathing, you need to watch them very, very carefully. There are a lot of signs and symptoms that may not occur for several hours after this event. Obviously, altered mental status, alertness problems, confusion are signs of a serious injury and needs to be seen immediately. Cyanosis, coughing, production of foamy sputum, etc., fast breathing or fast pulse rate is an ominous sign that a serious injury has occurred. So there are other injuries that are commonly associated with drowning events. One is trauma. Diving in, obviously head first, usually, again, mostly male, averages age around 13 to 14 years. There is an association with head and spine injuries, but again, that's usually with diving into shallow pools. Along with recreational water activities, there's unintentional contact with the water, such as driving into high water or if a vehicle goes into high water. There's a lot of myth and misconceptions about exactly what to do. Some of the falsehoods are that you should remain within the vehicle and let it fill with water so it's easier to open the doors. Or you'll see, wait till the vehicle sinks to the bottom so you can get out and get your orientation set. Or kick out the windshield or open the doors after the vehicle is already sunk. None of that is true, and it's very dangerous information. Best approach to a vehicle entering high water or going into a lake unintentionally is to realize what's called SWOC. And again, what that stands for is get the seat belts off as quickly as possible, open the windows as quickly as possible. Most electric windows continue to work for 1 minute to 2 minutes. Get out immediately, do not wait for the vehicle to take on water or submerge, and get the children out first. Start with the oldest children. They can understand instructions and they move quickly to get out. It gives you more time for younger children who need more focus and help getting out of the vehicle. Turn around, don't drown. Don't try to enter swift water, even if it looks like it's not that much water and you think your vehicle can make it through. A lot of the vehicles float and are moved very, very quickly into deeper water. If the vehicle remains floating, and most vehicles will float for up to 2 minutes after entering the water, is to get out. If you can't swim, try to stay with the vehicle and stay on top of the vehicle. Get out upstream, climb on top of the vehicle, and again, try to stay with that as long as it will float. Once a vehicle starts to sink or submerge, etc., you need to get away from that as quickly as possible. So what can you do if you are a witness to a drowning? First thing is to make sure the patient is safely out of the water. If the patient is breathing on their own, that's a very good sign. Try to support them. If they're not standing or alert, let them lay on the ground, put them on their right side, kind of support their ventilation. Call 911. If someone is pulled from the water and they're not breathing, what you need to do, obviously, is to contact 911 and you'll receive instructions. Better yet, contact your local EMS for CPR training. You need to make sure that their airway is open. If they're not breathing, rescue breathing instructions will be given to you. If they don't have the pulse, you'll be instructed in CPR. If you call 911 and EMS arrives, what can you expect? Obviously, the first thing is for us to do advanced resuscitation, try to open the airway and get the oxygen flowing to the lungs again. Cardiac resuscitation, if indicated. And then again, we're going to assess for other injuries related to drowning, spine injuries, hypothermia, and get you to the hospital. Even if there's been a minor drowning instance, if you think you've had water inhaled, if you're coughing, if you just feel a little strange, if you're not quite with it, etc., some of the symptoms of severe drowning may take several hours to present. The earlier that you can come into the 911 system and into the hospital to get your treatment, the better you're going to be. The best treatment is prevention. Obviously recognize the dangers in your home. Recognize the dangers that are specific to the people around you, infants, children, adults, etc. Parental supervision is absolutely imperative around any kind of water source. Remove the hazards, large cleaning buckets, open toilets, etc. Watch your children. Additional safety devices such as tub seats for infants are really impactful at saving these drowning events from happening in small children. Alcohol avoidance is very important in water sports, etc. And remember certain things. When you see high water, don't enter the water, turn around, don't drown. So if you have a question you'd like us to answer here at the Harris County ESD11 EMS, just contact us at the information below and say, "Hey, Dr. K, I have a question." For the Harris County ESD11 EMS service, I'm Dr. J. Kovar.